happy to have you here. Sorry for the this EJSCREEN tool is developed by SAGE, which is the Center for Community Engagement, Environmental Justice and Health. It's under the School of Public Health, Global Environmental and Occupational Health. Next. So to introduce what's environmental justice. Environmental justice is a fair treatment and meaningful involvement of all people regardless of race, color, national origin, income with respect to the development, implementation, enforcement of environmental laws, regulations, and policies. Executive Order 12899 directed federal agencies to develop environmental justice strategies to help federal agencies address disproportionately high and adverse human and environmental effects of their programs on minority and low-income population. The Presidential Memorandum 1994 accompanied the order of underscores certain provisions of existing laws that can help ensure that all communities and persons across the nation live in safe and healthy environment, and it's signed by President Clinton in 1994. Next. So what is environmental justice screening tool? So it's a tool to show where is the problem, where is the hazard, where is the pollution. So it is environmental justice screen a tool that utilizes standard and consistent data to highlight places that may have higher environmental burdens and vulnerable populations. The tool offers a variety of powerful data mapping capabilities that enable users to access environmental demographic information at high geographic resolution across the entire country, region, state, displayed in a color-coded maps and also reports. These maps and reports show a selected location compares to the entire US, to the entire region, to the entire state, and at the same time you can compare also within a county which census tract is highly affected by environmental pollution and environmental injustice issues in their local area. So to do this environmental justice screening tool, we need GIS, which is a software combines all this data together to show us in a map. Next. Next. Yeah. So what is GIS? Geographic Information System, GIS, is a computer system for capturing, storing, coding, analyzing, and displaying geospatial data. GIS allows geographic features in a real-world locations to be digitally represented and stored in a database so that they can be presented in a map form and can also be analyzed and manipulated to address some problem. So as you can see, we have many things. We can street data, we have building data, vegetation data integrated. So we integrate all this data and we show it in a map. So that's the capability of GIS. So for example, you can see here, the EJSCREEN tool from EPA is developed by GIS. That's an example. This is developed by CDC. So they use GIS to produce different maps to help the community understand the problems in their local area. Next. So what is GIS components? To do a GIS, you need many things. So you need an expert, researcher, technician, analyst to question, to analyze the data. We need hardware, a computer system, technical equipment where operates. We have also a software. We have also methods to do the calculations, to combine the data. And at the same time, we need data. So those data can be a vector data, a raster data. For example, we collect data from satellite. The satellite data are come by raster data. We collect vector data like street maps. So those are vector data. We can, but not only the location information, the location information also contains attribute table. So the attribute table is information related to that place. How many people live in that area? Is it black or white? Is it above 64? Is it young generation? So we classify based on this data. Next. So what is the objective of Mid-Atlantic EJSCREEN? It is to focus issues in the region. For example, EPA EJSCREEN works the whole US, so it compares the information based on the whole United States. But this compares only to those 6 states. So it allows users to explore layers of environmental justice concern, determine the overall EJ score for census tracts in the region. The tool helps to compare and analyze EJ scores and domain scores within the states, county level statistics. The tool also illustrates differential burden of climate hazards within the region and across the population. Next. So where do we get this data? All this data came from different sources, including the federal and also like EPA, CDC, FEMA, USDA, like Forest Service. We collect all this data from different agencies, and we tailor the information to our region. Next. So what health indicators we include in this tool? As you can see, we include asthma, cancer, diabetic, health disease, high blood pressure, poor mental health, depression, high cholesterol, stroke, and COVID. Next. What are the climate indicators? Avalanche, coastal flooding, cold wave, drought, earthquake, hail, heat wave, hurricane, landslide, flooding, strong wind, tornadoes, tsunami, volcanic activity, wildlife, winter, and expected annual loss. Next. What are the demographic indicators, or we call it socioeconomic indicators? We collect data, people of color, low income, less than high school, limited English speaking, individuals over 64, unemployment, housing burden, age 17 and younger, civilian with disability, group quarters, housing costs, housing tenure, lack of broadband access, which is internet, lack of health insurance, lack of indoor plumbing, mobile homes. Those are under the demographic indicators. Next. The environmental exposures indicators are related to air toxic, cancer, air toxic respiratory hazard, diesel particulate matter, which is coming from vehicles, particulate matter, ozone, traffic proximity and volume, NO2 level, carbon dioxide, methane emissions. Next. The environmental effects are related to lead paint, which is related to homes, proximity to risk management plans, proximity to storage, proximity to NPL sites, water discharge, impaired water bodies, hazardous waste proximity, superfund proximity, underground storage, coal mines, lead mines, and lack of green cover. Next. So how do we combine all this data? We have many indicators, so how do we combine it? To calculate the EJ score, methodology similar to used by California EnviroScreen was applied. So the raw indicator scores were ranked from lowest to highest for each indicator. For example, if the asthma data ranges, for example, 100 to 1,000, we convert that data from 0 to 100 for comparison purpose. So the 100 will come to be 0, and the 1,000 will be 100. So that's the way we convert the data. These values are averaged to create 2 scores per census tract. So the population characteristic and pollution burden score. So we have related to population characteristics and at the same time pollution burden category. Next. So all data are processed using ArcGIS. So all data are converted to 2020 census tracts. Because Census Bureau updates their map based on their population statistics, the 2010 is different from 2020 census tract. because some people move from Maryland to Virginia. So to accommodate that, they modify these maps. So we use it 2020, but if we found a data collected from 2010, we converted that to 2020 to reflect the current map. So we also used Microsoft Excel for processing. Next slide. So this is a summary, all what I'm talking right now. So as you can see, we have the environmental exposure, environmental effect, climate. So we combine these three to say pollution variance. Those are the pollution variance. So we combine the health data and socioeconomic factors, and we bring that for population characteristics because those are more or less related to population. So after we collect this and calculate this and calculate this, we finalize the final composite EJ score for that particular census tract. So as you can see, we have climate 17 indicators, environmental exposure 9, environmental effects 13, health 10, socioeconomic 16 indicators are used to develop this tool. As you can see, the formula we applied to calculate, those are based on this. Next. So after this, I'm going to talk a lot about percentile. So just give me a few minutes to explain about percentile. What does mean percentile? Percentile shows the percentage of people that score above and below a certain score. For example, if a score falls in the 97 percentile, it means that 97% of the people that took the test got lower scores, and 3%, which is 100 minus 97, got higher scores. So all my explanations are based on this graph. But for example, this is a test score. So I like to have 100% in my test score. That's good. But in environmental justice issues, 100 means bad. It's the reverse. So if a census tract scores 97, that means compared to other census tracts, this census tract is very, very bad. Next. So this is a question, by the way. If you go to the SIEGE website, and under the tools, you will find the tools we have, Maryland EJSCREEN, Mid-Atlantic EJSCREEN. If you have a phone or a computer, you can go right now, and while I'm presenting, you can follow me using that tool. So it's in the website, SIEGE Center website, under the tools. So this is a question from my previous, so you can see what's executive order, federal actions to address environmental justice minority population, was issued by President Clinton. When did this president sign this executive order? It is just a question. How many domains and indicators included to develop the Mid-EJSCREEN tool? This is from the previous screen, so just to give you a question. What are the greenhouse gases included in this tool? This is also part of the presentation. I mean, to give you, can we obtain a cumulative EJ score for the Mid-Atlantic EJSCREEN tool? That's also explained. So just this is to give you some questions. Go ahead. So the tool looks like this. As you can see, we have Pennsylvania, Delaware, Maryland, DC, West Virginia, and Virginia are those included in this tool. So we have the overall, which is a cumulative EJ score, EGI, and we have health, environmental effect, environmental exposure, climate change, and demographic. We have also added a report. If you want to report for your local area, you can click this Get Report, and it will take you to the website, and it will give you a detailed information about your area. And we can also, there is an option to download the data. If you want to go to the another websites related to EJSCREEN, like the EPA IRA and the CGS tool, which is, we presented this morning, you can click that and go. And at the same time, we have the website. You can go to this website and see this EJSCREEN tool. Next. So Okay, we have this tool, and we want to compare the region, the Mid-Atlantic region. So we say top 25 census tracts with the highest cumulative EJ score. Where are those located? So as you can see, we have 25 census tracts from the region. So we have the county, and where are those? So as you can see, in Baltimore City we have 9, Berks and Delaware County in Pennsylvania we have 3 counties, Coppell County and West Virginia, Richmond, we have 2 each among the top 25 worst affected census tracts in the region. Yes? Why is not here? Well, this is not among the top 25 worst affected census tracts. That's why. Yes, but as you can see, those are like, see, this is one is Baltimore City, so it's 9999 is still in Kanawha, so it goes to 9997. So among those, this is not among the top 25 because, as I said, the cumulative environmental justice averages a lot of things. It's 65 indicators. When you do that, it's a little bit, it doesn't show you, for every census tract. So this is a comparison as a region. So, but I will show you also, there is a DC information below this. Next. Okay, what about if we compare it like above 75 percentile? Can we compare the states based on the percentile calculations? So as you can see, I have Delaware, District of Columbia, Maryland, Pennsylvania, Virginia, West Virginia, and I have total. So census tract above the 75 percentile, Delaware has 71, 68, but this is very hard to compare because some states have many census tracts and the others have low. So, but when I compare this is the percentile, 33%, West Virginia 46%. So West Virginia has the highest percentage of affected when we compare it above 75 percentile, followed by DC and Pennsylvania. Next. Okay, what about if we select the 90 percentile? When you see the 90 percentile, it comes DC. So there are many census tracts in DC above the 90 percentile compared to the other states. Next. So this is the environmental exposure map. So if you want to see, what about if I want to see the environmental exposure only? If you want to see that, you can see the major metropolitan areas in the west are highly affected by environmental exposures related to diesel, related to ozone, and others. Next. So what about the effects? You can see also there is variability around the region. Next. Okay, I want to compare again. What about environmental exposure comparison within all those states? As you can see, there are 205 census tracts in DC affected by exposure, which is greater than 75. And DC had 206 census tracts. So almost 100% census tracts in DC are affected by exposure compared to the effects. When you see the effect, it's 117. So you can compare based on this analysis also. Next. So you can also go to a specific place in one area and check what's look like my neighborhood. So when you put your address, this is like Baltimore City, Maryland, but you can just say 200 K Street, Northeast, Southeast. You can't say that. So when you do that, it gives you socioeconomic exposure effect, and when you click this, it also gives you the other component. So it gives you these statistics when you click the report. Next. This is Northeast Washington, D.C. So as you can see, it's almost 90-something% related to exposure. It's almost, you see, as you can see, it's close to 900% related to exposure. Next. No, no. Certain comment. It's based on the specific where you click. Where you click, you will see it. If you have your phone, you could just go to the website and see by putting your address. Okay, this is the climate change. You can also see. And the red means bad, and the lighter yellow means okay. Next. This is the health. Next. This is also the demographic. Next. So another comparison is, what about if I see climate, health, socioeconomic comparison? So greater than 75 percentile in DC has only 6 census tracts based on the climate. But the other one, the exposure is almost 100%. So the big problem in DC is the exposure, not the climate. So, next. Okay, here is a map to show you DC. This is not this. This is southeast part. So as you can see, it is more or less about 60 percentile the whole. So, but this area is more or less between 0 and 20. In Delaware, the central part and this around Wilmington area is highly affected by the overall EGI. Next. Okay. Now, I don't know which census tracts you live. So if you are from Delaware, you can see in Delaware, it is this census tract which is highly affected. In DC, it is 401, highly affected. Next. So southeast, that's another statistics to go. So as you can see, I just Googled Martin Luther King Jr. Southeast Washington, D.C. It gives me this address. So this area, and I have one yellow something, so that's this one, and the others are just almost 100%. Next. Dover, this is Delaware. You can see also that. Next. So this is Maryland, just as you can see. Next. Okay, Maryland, you can see where is this? I think 250-103 is the highest census tract, which is highly affected by environmental injustice issues in the state. Next. Okay, what about county? What about if we calculate like, okay, I'm talking about census tracts. Census tracts, I mean, generally no one knows which census tracts, but when we average the values based on census tracts, it gives us Baltimore City 0.8. This is the overall average within the whole city, followed by Caroline, Dorchester, Somerset, Kent, Washington, and Allegheny. Next. So this is Baltimore climate, composite, and health map. Next. This is Coppin State University, still in Baltimore. Next. Okay, when you come to Pennsylvania, next. So Pennsylvania, as you can see, the highest affected in Pennsylvania is 420-1100-2500. Followed by the others. Next. What about if we compare county level? which is Philadelphia, Montour, Lebanon, Lenin, Fayette, Mifflin, and Dauphin. Next. So this is also the statistics for Philadelphia. Next. This is Orbrook Environmental Education Center. This is one of our hub partners, so just included the location of their area. So as you can see, it's mostly high AGI scores. Next. This is Virginia. Next. So Virginia, the highest score is in 5176006070. As you can see, 760 is Richmond City, so that's a highly affected area. Next. What about the top 7 worst affected counties in Virginia? It's Norton City, Henry, Martinsville City, Pittsburgh City, Waynesboro City, Emporia, and Dixon. But this is average because I was checking about how many census tracts are within Norton City. It's a small city. That's because, but Richmond has also many areas affected by environmental injustice issues. Next. So this is just to show Alexandria report. Next. West Virginia, as you can see, West Virginia is a highly affected state when we analyze this tool. So as you can see, this census tract has the highest AGI score in the state. Next. When you calculate the county level statistics, it gives you Wayne, Mingo, McDowell, Bonny, Mercer, Pleasance, and Wyoming. Next. So this is also another statistics. Next. This is for West Virginia State University location, where it is. So that's the statistics for that area. Next. So the summary is West Virginia has the highest percentage of census tracts with scores above the 75 percentile, followed by Pennsylvania and Washington, D.C. D.C. has the highest percentage of census tracts with scores above the 90 percentile, followed by West Virginia and Pennsylvania. Overall, D.C., Baltimore, Philadelphia has the highest scores in the region. Next. So this is a general question. You can answer the questions based on the map. You can see there is the link there. So you can go to those areas and check what's happening in the specific locations. Next. So if the website works and everything, we will try to demonstrate the tool. So Bukola, my colleague, will come here and I will try to manage this thing.
Oh, great.
So as you can see, this is the website. Everyone can go. It is open for public.
Yeah, the website is on the Siege website. So if you go under the tool tab, you see the Mid-Atlantic EJSCREEN. Like you said, it's open. It's a public available tool, so anybody can access the tool. Then you have the zoom in and zoom out. You can use this tool, the one like a plus sign. If you click on it, it zooms into the map. If you want to leave without your default, you click the minus sign and it shows you the full map. Then you have the search bar. Here you type in any address of your choice and the map will zoom into that particular location. So it's going to type in an address and you see. Okay, maybe. quite red, so yeah, the area is so you can click on it. So when you click on that area, it shows you the overall EGI, which is 91.2. Then for each of the domains, you have environmental exposure, you have 100%. For environmental effect, 0.998 percentile, demography, climate change, health, and the score is 1. So that's a very high EJ score. So the area is bad. So, okay. Yeah.
Our community, this is one of our communities that we know has a high level of pollution and toxins and everything, and has a trash transfer station.
Wow.
Have a lot of things. So when we look at this map and we show it to, does the EPA honor what's going on here on this map? No.
Yes, I believe so. Because we use
No?
yes.
Yeah, the reason we are having this tool is for you, or use this tool.
Use to have the information to be able to use this tool. Yes, but it's also good. It gives you a visual representation. What we do at Siege, if you want to write a grant or a proposal, and you need a map to visualize what you're actually saying, so we'll readily give you this map, so you're armed with this information, and you can present that information. So it's a different thing when you say something, but when you see the visual of it, so it's clearer and
And I'm sorry to cut you off, but the reason why we're here at this symposium is because we need folks to know that what the community is saying is not matching what's, or when we show these things to like DOE and EPA, they're not looking at that. They're looking at other metrics. So if they was to look at the EJ screen, which we have showed it to them before, and we don't need to screen the EJ screen to know what's going on in our communities because we're there 24/7. But when we show them the data, it still doesn't matter because it's almost like, well, it's just a tool. It's just a tool. It's not an official.
sure.
The official metrics that
Fix.
they would use to say, oh, well, this community is highly polluted, so we're gonna shut everything down, or we're gonna give, we're gonna make sure that they have the proper permits, which they don't. Shutting everything down, they don't. And then eminent domain takes years. So we're still left with a tool.
Tool.
That's showing us something that we already
No.
know. That our agencies don't use. Or don't say that they are legit data. It's not legitimate.
Yes.
That's what it comes down to.
Yeah.
Exactly.
Yes.
So, to your question, like, I'm not aware other than, like, you can use this information for advocacy and maybe for a grant from the EPA, but there's no mechanism to say, we have a lot of pollution, therefore shut things down, or make anything actually happen from EPA to combat pollution. There's no mechanism for that, unfortunately, that I'm aware of, but there's no, please tell me, how they sit here. My question for you is, can you drill down into this, because just seeing scores or rankings isn't necessarily as helpful when, like, she's talking about does the trash transfer station that part of the city and all these other things, but is that part of why is this color? Or is this based
Yes,
on,
that
like,
is-
how do we know what this is based on?
This is based because it's color coded, so they hire
I
the
get that, but what's it based on?
it's
Can you
based
get to
on
the
the
number?
domains and indicators. So each of these domains have indicators. We have like 65 indicators in total.
Right, but can you get to the data, like if I want to find which
Yes, if you
polluters
want-
are counted towards the
Yeah,
environmental effects score?
just one minute. For example, we have 5 domains. The one we are showing right now is the Mid-Atlantic EJSCREEN scope. So that we can go detail. For example, I'm just clicking head right now. It's going to take me to head. So when I go to head, it's going to show me all the indicators from 0 to 100. So you can go to your location and identify which indicator is the most significant or weakened or affects your area.
Okay, so if I wanted to drill down and say, okay, how do I get statistics on cancer risk in my area?
Yes,
Or a
right.
ranking of that versus every other location in Pennsylvania?
Yeah,
Can you get that?
Yes, can you, the
Yeah,
address,
you
do you
can-
have an address that
So
we
you
can?
have- you can also get the, by the way, the overall statistics for each in an Excel or as a format, and you can see which one has the highest cancer rate in the region and the lowest cancer rate in the region. It is for everything, it's calculated, some data has like 10, 20, 1,000 something, so we scale all the data from 0 to 100, so you can compare.
But can we get to the actual data point, not just the 1 to 100, but can we get to, like, whatever the actual measurement is? that
Oh,
can
the actual
determine-
measurement, yes, yeah, it's in the CDC website. So, but this is a data converted to percentile. The one we have in this map is a percentile.
Because one of the problems we've had with getting health data, particularly from state departments of health, is that they wouldn't give us data that's very close. Like, they would give you county level data or zip code level data, but they'll only give you zip code level data if it's not, if it's more than 10 incidents, like asthma attacks or something. And they say it's a privacy concern if they give you a lower number. And that was in Pennsylvania, it's at 10, in Virginia it's at 10. Like, really, well, where is this number coming from? They're like, okay, how about 5? Like, this is a negotiation. Okay, so, like, I don't know why privacy laws are pretending that, like, if there were 2 people in a zip code that had asthma attacks that sent them to the hospital, somehow we're gonna be able to figure it out because the number is 2, like, that makes no sense. But is that, do you have all the data available, or do you have the same limitations, or what?
As I say, all the data came from EPA, CDC, FEMA, USDA, so all those data are downloaded and converted to percentile. The one we are showing here are percentiles converted.
Okay, so can we get the original non-percentile data from you, or no?
Well, no comment right now. No comment right now. So the reason we have EJSCREEN tool is to screen your area or your neighborhood. The reason we have EJSCREEN tool is, for the community to identify and compare the neighborhoods and areas for different purposes, including to lobby policymakers and at the same time write a proposal showing that this looks like and we intending for this. This is as an initial screening tool that we can go further, dig and find other data sources also to back up if you want to improve your proposal acceptance.
Which is that's what we're trying to do, is to use and see and different organizations to help us do this, because we're not getting the support from EPA. We can look at it and be like, what you said, it's just
I thought you raised up your hand before. Oh, okay.
From the aspect, it's not a question. It's rather a comment, piggybacking. You know, when you every time you kick the football and it goes through between the posts, and you think you scored, but they said no, not exactly. You guys, the goalpost keeps moving. So it's frustrating when you have these type of events, and you find out that you can pinpoint it down to a certain percentage for asthma, for cancer, and everything else. But when it's taken to your city council, your mayor, they say, no, because the metric is 1.25, and then you ask, well, where are we? You're 1.24.9. Okay, and you're like, you want to choke somebody because, they're telling you, there's nothing wrong, but you're 1 percentage point away from death. So I'm not asking a question. It's a comment and frustration to come to these types of events. I help groups put together health fairs. The reason why people don't come to health fairs because they don't want to know how sick they are. Okay, they know they're sick, but they don't want to know how sick they really are. And that's the frustration when people are left to that type of position where, the goalpost keeps moving. Every time they get there, it keeps moving. And you have the information, and maybe from a legal point of view, you can't reveal that information to us to use it to take another type of action when your population's been dying. One of the reasons why we helped bring the first prenatal mobile unit into this region, and one of the reasons was Ward 5, because there was a lot of deaths, there was a lot of prematurity, there was a lot of low birth weight, and all of that you can connect it to. It was also Ward 7 and Ward 8. That's another discussion. But it was Ward 5 was the reason why we created a partnership with the Market Times and brought the first mobile unit into this region. So, we were showing that babies were being affected, the mother being affected because their breathing was cheap.
Excuse me, I just wanted to say something, it's kind of like piggybacking off of everybody. It sounds like they're using the confidentiality and the Privacy Act to hide what is real because they know if they really expose these numbers, it's not like we all here are scientists, right? They're saying, okay, you guys can use this to learn this. But once we start learning, because knowledge is power, once we start learning, and they get scared because now we understand in layman's terms what's really going on. So we bring this to them, and because they didn't bring it to us, it's not real. But if we bring it to, if they bring it to us, it's real, but we bring it to them, oh, it's not so. So why do you give us all this information? We start educating each other, we learning this stuff, then we bring it right back to you, because y'all the teachers, we the students, now the students know something. So the students bring it to the teachers, and they saying, we'll get back to you. So it sounds like, they're using confidentiality and the Privacy Act to hide what's really going on, because they know they probably got air purifiers all over the place, because they know what's going on all in their house, but they leaving us out here because, the truth is what it is. The truth sometimes hurts, and the truth sometimes people don't want to get in trouble because there's people all that reality up underneath the rug, and just because you might be a decimal off or something like that, they want to say, not real ours is. So even, I think sometimes we come with the right data and they have the right data too, but they gonna change the numbers around because they don't want it to be really what it is. You know,
And we don't have no time to waste because people dying every minute.
they probably got stuff in their basement already ready for when it's gonna hit, and we gonna be the ones sitting out here looking crazy.
Yeah, uh-huh.
I have a question about, kind of the new air pollution standards that the EPA just, released for like the NOx, and I'm sure that they probably didn't upload those new standards into their EJScreen tools or the CDC's tools as well, so I'm wondering for like purposes for you all to get ahead of the game, since you all are already, combining all these different data sets,
Yes.
could you all apply the new standards to the
Yes.
current tool?
Not, we checked the EPA, the new one, they added some indicators, but we didn't include it for this tool.
They said they already have that. I thought the EJScreen tool was like 2 years behind.
They just
No, they
so-
updated it right now.
recently, yes, it's updated.
Yes.
Yes.
So when they updated it, just we will also add updates that. We also have Maryland EJSCREEN tool. We are working on that also. We have 3.0 right now, but we are going to upgrade that to 4.0, which includes many like gases, pollutes the area. So we are collaborating with George Washington University to collect data from satellites, and we are going to update the EJScreen tool to show the current data. Right now, just starting this year, yes.
And I want to say another thing too, I'm just learning all of this stuff, but, I'm an advocate and I advocate, so I pretty much shoot from the hip and I say what I gotta say, but I say for everybody, I only talk for me because I might come from Ward 1, but I'm for all the wards because DC is my city, right? And that's where I live, but my thing about it is they send you guys out here, or they send whoever out here to talk about what's going on, and it's like they put a piece of tape over y'all mouth, so y'all won't really say anything because they say if you say this, your job is on the line. If you do this, your job is on the line. So why do they even waste their time to send y'all out to talk to us, and then y'all say, well, I can't say and I can't elaborate because y'all know the truth, and y'all can't give us the truth because y'all know what's really going on, but y'all can't say anything because guess what? Y'all will be held accountable in lawsuits because somebody gonna have to get the guts and say, look, I'm tired of keeping everything under the rug because when it start affecting y'all family, then y'all family means something. Our families don't. You know what I'm saying? So that's my problem. Like, say what it is, so we can all work together to protect each other all across the world, not just in DC, everywhere. That's how I feel about it. If it quack like a duck, look like a duck, it is a duck.
Well, as I said, we are trying to give information which is screening tool. What does mean screening tool is this is going to help you screen what's happening in your neighborhood. But you have to back up with different data, including our data, to show your policymakers or funding agencies to fund that. So this is a tool which helps you to identify your area and your neighborhood.
So I have another question going back, that I'll be fine with. So because going back to Sabrina's point, we've done this, we've shown the policymakers the results, we've been doing the work, and we've been doing this. So I'm wondering from the GI, and the thing that we get told all the time is, oh, that's just guidance, because like, yeah, it's just guidance, it's not set in stone. Like you couldn't take the EJScreen tool to court, it's not, that doesn't hold up. So, what, from you all's perspectives or like from the GIS community, what can you all do to help the community more? Like, it's one thing to just provide us the data, but we also need the scientists to really start having, I guess, maybe you all need to be doing the advocacy work to make sure that the legislators, and not even just the legislators, but our government are not only using this data for guidance, but making it into law or making it into the standard practice.
Yeah, by the way, we participate in that too. We participate in Delaware, we participate in Maryland. Yeah. So personally, Dr. Wilson also participates in different, yes. Yes.
To meet the standards, so I would love to know. I'm not just saying this.
Yeah, we participate. I mean,
let us what you know
Yes.
from the community advocates to help you all,
Yes.
fight for that.
Yes.
Because again, like you all giving us this data and we turn around to them showing the agencies their own data, and it's just like we're a side looking crazy. We see the reports because now they're wanting to do more monitoring, more testing and all that when we already have y'all just showed us, So it's just like we need
Okay,
y'all to
okay.
definitely not only just give us the data, but making sure that we're holding these governmental agencies accountable and making this into standard and not just guidance or not just, a taboo soft data collection activity. So
And last question, please. Last question. Very
That's what we do at Siege. We also are actively involved in advocacy. Apart from giving the information, we partner with communities, we advocate, and Dr. Wilson is very much involved in the advocacy. Yeah.
no one else has a question. Okay.
Okay.
So a couple of things. First, on following up on my earlier point, like one reason why it would be helpful to have the underlying data is because sometimes like it's not enough to know that you're 90th percentile. Maybe you're so far off the map that you're like 7 times worse than average or than the 90th percentiles in general. And it would be good to know that, but we can't know that if it just says 0.9. Like we would need the raw data. And so I'm interested to know, like, what does it take to get that, or are there privacy laws or some reason you just can't release that? But I know you
As I
said
say, the
well.
data are, you can find, especially the CDC data, they are available in their website.
Okay, that's not been my experience. Maybe there's, we can talk and you can tell me what it is.
Yes.
Okay, okay.
Mine is like down the county that border.
But honestly speaking, it's like a broken record though, y'all, for real. It's a broken record.
Okay, okay.
Yeah.
Yes.
I just wanna ask, if you went down to technical assistance, could they print you out, just print out?
Yes.
Yeah.
And then my other questions were, and I hear your frustration, this is hard work, it's thankless work, and it's hard, it is a lot. But I'm just thinking, in order to answer them, could they print out their data for their community and compare it to an associated, non-black community?
Yeah, we've done that.
And you,
Yeah.
you've done that? And then, is the number,
We've seen the life expectancies, we've seen the higher rates, like Brentwood.
is it drastically
It's
different?
drastically, Brentwood is in a
Then why
90,
didn't you
80%.
go to-
We have testified at performance oversight hearings, the agencies, we have the council members, we talk to the EPAs, go all the way up the chain of command.
I hear your frustration, but then you compared it to your non-black
Yes,
community
yes,
or,
yes.
an upper whatever class, economic viable community. If they do not respond, me as a social worker, that's a Title VI complaint. Department of Justice.
And we submitted Title VI.
Nobody can tell us anything that we haven't
They
already
closed
done.
it. Well, we're in the process of reopening it,
You
but.
have to prove it when it comes to, Title VI, there's certain things that you have to prove that you cannot prove. It's automatic.
Right, even using the EJSCREEN tool, like, you can't,
They're not.
right.
I hate to say it, but
Go ahead and say it.
the truth is it's corporate interest. And I know that's maybe not something that you all say, but it's corporate interest. So you start affecting some of these companies' pockets and make them care, because appealing to their ethos and their morality is null and void. They don't care. It's clear they don't care. Clearly, Mr. Brennan and my other coworkers have been in this space so long, it's not a matter of caring, it's a matter of, okay, now I need to affect the pockets. Now I need to make sure that
Even the federal agencies aren't really using this data. Like, I used to work at NOAA, and they're just now like, oh, like, social science. Like now they're like, these are starting to have an
I wanna
application.
make a shameless plug really quick for my research. Hi everyone, thank you for sharing your perspectives. My name is Kayla, I'm a graduate student at Florida A&M University. And my thesis research, which I told the presenters earlier, is actually garnering public perception and risk perception from these environmental justice, screening tools from the EPA specifically and the Justice for These Climate Economic Justice screening tool. And my research, like I said, is garnered on data
you know, everybody is sitting here talking, right? But you have kids, you have elderly people, you have babies. And you have babies with health problems. But they make it hard for you to get Medicaid and Medicare to help combat these health issues. They say you have to have nothing to almost get something, but you ain't doing anything to get these health issues. So why can't we be like other countries and facilitate free health care for all? Because of these big industries and all these warehouses and all that stuff that's giving us what we didn't ask for. But now you can't take care of us, and then you want to jumble the numbers up. That's the problem. And then everybody got to say, we got to fill out these forms every 6 months for your SNAP or for your Medicaid. Why can't we go do it every 2 years or every 5 years? Or why can't we just have it for a lifetime? Because everybody's aging and getting older. Excuse me, y'all. Everybody's aging and getting older and having problems. But you're not giving us health care. And you got people out here that are sick and are passing stuff on to people, and they won't provide health care. But they provide air pollution.
Well, thank you very much, everybody. We are very glad to have you here. Thank you.